Cancer is one of the biggest health challenges we face today. In the United States, it's the second leading cause of death, and millions of families are touched by it every single year. But here's something you may not realize. Just 3 types of cancer make up a huge portion of cases. Today, we're going to talk about those top 3 cancers, why they happen, what the warning signs are, and what you can do right now to lower your risk. Now, before we dive in, I want to make one thing very clear. Cancer doesn't just appear overnight. It develops over time, often over many years, and is shaped by a mix of genetics, lifestyle choices, and environmental exposures. That's actually good news, because it means there are steps we can take to protect ourselves and to catch cancer early when it's most treatable. Let's start with lung cancer. Lung cancer is the #1 cause of cancer death for both men and women. About 1 in 16 Americans will be diagnosed with it at some point in their lives. The most obvious risk factor is smoking. But here's the surprising truth. 10 to 20% of people who get lung cancer have never smoked. Secondhand smoke, exposure to radon gas, asbestos, even long-term air pollution can all play a role. The symptoms aren't always obvious in the beginning, but there are some red flags you should never ignore. A cough that doesn't go away, coughing up blood, chest pain, shortness of breath, or losing weight without trying. If you're over 50 and have a history of heavy smoking, doctors recommend a low-dose CT scan every year because that can catch cancer early when treatment is far more effective. And if you're still smoking, quitting now can literally change the trajectory of your health. Even after decades, your body begins to heal the moment you stop. Now let's talk about colorectal cancer. This is the 3rd most common cancer in both men and women. What's alarming is that it's being diagnosed more and more in younger adults under 50, and doctors aren't exactly sure why. Diet plays a big role. Eating a lot of red meat, processed meat, and low amounts of fiber increases risk. So does being overweight, not exercising, smoking, and heavy drinking. If you have a family history or conditions like Crohn's disease or ulcerative colitis, your risk is higher as well. The warning signs can be subtle: blood in your stool, ongoing changes in bowel habits, stomach pain that won't go away, feeling tired or weak from anemia, or unexplained weight loss. The good news is that screening doesn't just find cancer, it can actually prevent it. A colonoscopy allows doctors to find and remove polyps before they ever turn into cancer. Guidelines now recommend starting at age 45, earlier if you're high risk. And yes, lifestyle makes a huge difference too. Eating more fiber from whole grains, fruits, and beans, exercising regularly, keeping a healthy weight, and limiting alcohol can dramatically lower your chances. And then there's breast cancer. It's the most common cancer in women, not counting skin cancer, and about 1 in 8 women will face it at some point in their lives. It can also affect men, although that's much less common. Risk increases with age, family history, and certain genetic mutations like BRCA1 and BRCA2. Hormone replacement therapy, obesity after menopause, alcohol use, and not being physically active also contribute. The signs to look out for include a lump in the breast or underarm, changes in breast size or shape, discharge from the nipple, dimpling of the skin, or persistent pain. But the most important thing with breast cancer is screening. Mammograms save lives. Depending on your risk, most women should start around age 40 to 50 and continue every year or 2. If you have a strong family history, genetic testing and earlier screening may be needed. Prevention matters also. Staying active, maintaining a healthy weight, limiting alcohol, and even breastfeeding can all reduce risk. When you look at these 3 cancers together, lung, colorectal, and breast, you start to see a pattern. The same risk factors keep showing up: smoking, obesity, alcohol, poor diet, lack of exercise. These lifestyle choices are powerful, and studies show that up to 40% of cancers could be prevented if we made healthier choices. So what can you actually do starting today? Quit smoking and avoid secondhand smoke. Build your meals around plants, vegetables, fruits, whole grains, and beans. Get at least 150 minutes of movement each week. Limit alcohol. Learn your family history and talk to your doctor about whether you should get genetic testing. Stay on top of recommended screenings like mammograms, colonoscopies, and lung scans if you're eligible. And above all, listen to your body. Don't ignore changes that seem unusual. Cancer can't always be prevented, but so much of your risk really is in your control. The earlier it's found, the better your chances, and the more healthy choices you make now, the stronger your protection is for the future.